The next question is about dementia. And we deal a lot with dementia, Alzheimer's disease, Parkinson's disease, ALS, and that's why it's so important to find a dentist that can come to your home. So the next question is, how do we deal with the dementia patient?
When it comes to dementia, I want to find out if the patient is on medications for dementia. I want to know if the patient, who the caregivers are, because ultimately speaking, I'm going to be communicating about treatment and diagnosis with the caregiver. I want to make sure I know who the power of attorney is, both medical and financial. And once I'm there, I want to know who's going to be there with the patient so that not only am I communicating with the patient, but more importantly, I'm also communicating with the loved one who's going to be helping me diagnose and treatment plan for this patient. That's number one, first and foremost.
Extractions? When it comes to the extraction part,
Sure.
How do you deal with the dementia patient?
So when it comes to the dementia patient for extractions, I want to make sure I'm isolating just that one particular tooth. I don't want to do a whole block when it comes to making the patient numb. There's a really good chance the patient is going to be unaware that they're numb. They might start biting their lower lip. There could be a lot of complications involved. So we can provide, like you were mentioning before, a special injection where we just go around that one particular tooth so that that one tooth alone will be extracted. It is incredibly, it's much easier to be able to do it that way. The patient is more comfortable, and all around there's less trauma involved.
Right. And then also I'd like to add that we put in a medicine that coagulates the blood. So we never leave a patient bleeding. We never. If we have to be late for the next patient, so that's why we're late sometimes, we make sure that patient is comfortable before we leave their home.